There are two kinds of genetic diseases that one can have. There's either caused by environmental factors, for example, certain cancers like lung cancer can be caused by asbestos and cigarette smoke, but there are genetic diseases that are inherited by parents' genes. So, to explain more on the hereditary diseases, I need to further explain some facts about genes in general, more where they're found in the cells and how they affect diseases. So, in every cell, there are 33 pairs of chromosomes. They're found in the nucleus, and they're basically made up of tightly wound DNA. Now, what makes up the DNA? As you can see, the structure, sorry, it's quite dark, but if you can point out the horizontal bars there, each horizontal bar is made of a pair of bases. Now there can only be 4 different bases, and the combination of these pairs will give a different command when the cell reads off the DNA. Now specific parts of the DNA, sections of the sequence, will be coding for a specific type. For example, you have a section in that particular chromosome coding for example eye color, and that is called a gene, a type of gene. Basically, gene coding for eye color can be any color depending on the genes which are present in the chromosome. Now, in a pair of chromosomes, as is obvious, there are 2 chromosomes. Obviously, they match up according to their genes. So, a chromosome containing a gene for eye color will match up with the other chromosome having the gene for eye color. Now, here are where hereditary diseases come in. Some diseases, you may hear people saying that they're carrier for diseases, not totally affected. What does that mean? Some hereditary diseases need both genes on the chromosomes to be defective, having some problem with the sequence. If, for this illness, for example, cystic fibrosis, if a gene is defective but the other is completely normal, then the normal gene will work instead of the defective gene. Therefore, the person will effectively have no symptoms but still carry a defective gene, which may be carried towards its next generation. As obvious, a fetus has half of its genes from one parent and the other half from the other parent. So, depending on the parents, if they are carriers or not, will affect the child, seeing if she's going to be a carrier or will be normal or unfortunately be affected by the disease. Now, as I mentioned before, cystic fibrosis is one of the diseases which need both genes to be defective, therefore have an abnormal sequence in order for the person to be affected. Now, taking an example, the father is a carrier but the mother is completely healthy. If the child, the half that it gets from the father, has the abnormal gene, the baby will be a carrier. Why? Because the mother has totally normal genes, and the abnormal gene can only be received from the father. However, if both are carriers, and the baby is unfortunate enough to get both halves having the abnormal gene, then yes, the child will be affected by the illness. But there's also a chance that it is also a carrier for the illness. Now, other reasons that a person may be affected, there are some diseases which don't even have to do anything with abnormal genes. Some diseases, you just need an extra chromosome. Therefore, in the formation of sex cells, the genes from the parents is divided incorrectly, and one set has an extra chromosome, which will be represented in every child's cell, and that is, for example, the cause for Down syndrome, where in a specific pair of chromosomes, it's basically not a pair, but rather a triplet. Another kind is, for example, color blindness, where it is shown more in one sex than the other. This basically obviously includes the sex chromosomes, that is a specific pair that is found in every cell, which determines whether you are female or male. There are 2 kinds of chromosomes. There is the X chromosome and the Y chromosome. Now keep in mind that the Y chromosome is much shorter than the X chromosome. Males are XY by females are XX. The gene that may or may not cause color blindness is found in the X chromosome. So, a female can be a carrier. Why? Because the X chromosome, the healthy one, can cover for that gene. But on the Y chromosome, the shorter part, the part that is missing, is where the gene for color blindness would be found. So a male cannot be a carrier for color blindness because he has no sequence which can override the normal gene. Another cause, another type of hereditary disease is when you just need one defective gene rather than two defective genes for the illness effect. For example, Huntington's disease, where a person, it's a degenerative disease, so a person will eventually start losing control of its motor skills, basically start losing control of its muscles. And if one of the persons is a carrier, the child, not a carrier, is affected. And the child has a 50-50 chance that it is either affected or healthy, because since you only need one gene, even if one set has a defective gene, then basically there's no way around it, you're either affected or not. Other diseases may affect one sex more than the other, not because of how they work or not because of how they are caused, but rather of how they work. For example, hemophilia is a disease which removes all clotting factors in the body. So, for example, what's the clotting factor? If you have a cut on your arm, usually the blood flow will slow down and the wound starts healing. In hemophilia, however, the wound starts healing much more slower. So, as you can imagine, for females who just hit puberty, it's a quite fatal disease for them once they start menstruation. It is found that diseases, that cancers, mental illnesses, and heart disease have a genetic component in it. So we all know that when doctors usually hear about a problem, they automatically ask you if you have, for example, heart disease in your family history, and this is the reason why. There is a beneficial part to knowing more about genetic diseases, basically since genetics and microbiology is still a new field, and nowadays, the more we know about them, the more we can treat, and the more we can avoid, and the more we can help people cope with diseases. It was recently found, in fact, that Alzheimer's has a genetic component, so a person knowing that is more susceptible to Alzheimer's disease, it's a kind of dementia. Telling the person that they are more susceptible to Alzheimer's disease may help them cope better with the illness and may help ease the process for the people around them. It was also recently found that behavioral disorders such as alcoholism and obesity, they have a genetic component which can make the person more or less susceptible to them. Unfortunately, there are no recommended testing just for it yet, but the fact that we know that there is a point there in the future where we can know whether a person is easier to pick up on the trait is already a step forward in life. Now, this all started from an article that I found. It was written in October 2012, and basically doctors found a rapid way of testing genetic disorders in newborns. Now, this is important because there are certain diseases, for example, bone disease, which basically causes seizures and loss of muscle, like loss of use of muscles. Especially to newborn babies, which is fatal. It causes most of the time babies don't even survive the first period. So time is really important for them at the time. And till then, testing usually used to take up 2 weeks, which is insane when you know that a newborn child can die from today's know. So having this new way of knowing if a child is diseased or knowing exactly which disease it is is quite beneficial and it helps, save a lot of time when no one likes having, a newborn and even enjoying it that much. And the software is quite simple. All the doctors do is just give them the symptoms, what symptoms that they see, and it narrows them down to a list of possible genetic diseases. And it's just a day later or two, after every testing, they can finally administer treatment. And obviously, with life-threatening conditions such as these, the faster you administer treatment, the better it is for the baby's life.
As the chemistry managed my care values, now we're talking about the story of science. Now, before, so, basically, science, as we know it, has evolved to check out the generations, but what we all are focused on is the future, current development. We never actually ask what happened before, what occurred prior to this technology. We take into account that science, in its own right, is made up of 3 different subjects. But have you ever wondered how they actually came to be? Looking at the definition of science, you can see that astoundingly, first definition ever recorded was 4th century BC by Aristotle. Now, it is a very simple definition. If one have to extrapolate to modern day definition, you'll be amazed to see that it is very wide and broad. Let's take a look at each aspect of science, starting with chemistry. Now, chemistry, I can assume you all know that before, that it is actually simple. Study of matter to change the way matter goes. But have you ever wondered what happened before? What was it like? Did you know, for example, that it was actually called alchemy from 1230 BC to 1661? That the pursuit was the changing from base metals to gold, the elusive philosopher's stone. Well, actually, they actually evolved to chemistry instead of chemistry. A spelling mistake, I believe, by Bonello himself, from 1661 to 1730. From then onwards, it came to the currently known chemistry. Surprisingly, though, from research, only written records are from 1661 onwards, from the time of Lord Kelvin, Robert Boyle, Charles Law, pressure law, so on and so forth. Let's turn to biology. This is a basic definition from a typical glossary we find in every title. But what was surprising is that a certain Carl von Linné extravagantly defined biology in 1736, and to be a bit flamboyant, used Latin rather than English. Physics, yet again, typical definition, but surprisingly, only came to be in the 16th century. Unfortunately, it is still dates to this day, just like most of the science. It is still being developed. Continuing on physics, is it a just definition then, since we know it started 16th century to just define it pure and simple? Well, this is, in my opinion, a better definition, which literally means the sum and total knowledge under the present day physics. It simply states that since it's evolving constantly, you can't just give a basic definition, wide definition. You give a basic, capping it in that field. The same can be applied for biology and chemistry. Well, why then are they so modern? 16th, 17th century is relatively close compared to the 1230 BC or 4th century before Christ. Well, the reason being, unfortunately, is that past only exists as it is present in the records today. And what these records are is determined by what we ask. So history, in actual fact, is only what is recorded. We have lost so much history just because people forget to write it down, or it take over 100 years to record an event. So then you would ask, how far then would you look to understand the origins of science? So let's go back in time, and unfortunately I'll be going through the whole history, over 200 years, 2,000 years of history, and I'll be starting with ancient Greece. Callus of Miletus, around 604 BC to 546 BC. Unfortunately, as I already mentioned, it was recorded by Aristotle over 100 years later. So you'll be surprised how much there is. Well, let's continue. Callus, being a typical philosopher, back then sciences were under the theme of natural philosophy, studied creating theories. His first was the origin of life. And as written there, it's from water. Now, we all know that water is one of the most important factors of life. Without water, there is no life. So, for him to theorize that life came from water, which we know today as true from fossils, from studying fossils, is quite astounding. Well, he went on. Unfortunately, he jumped from biology to chemistry and started to talk about definition of basic substances. Now, we all know that we are made of molecules, atoms, and elements. Well, this guy here actually defined the whole thing without even knowing it. He postulated that we are made of shapes. So, and these shapes are again made of shapes, and so on and so forth until you come to energy. He said the end chapter has to be energy. Well, we know that atoms are made of protons, neutrons, and electrons, and these themselves are made from something else. We have, if I recall better, we went down to 3 levels of subatomic particles, and still going down. And yet, he wanted to go into physics. Nuclear physics to be exact, where he postulated that energy has to come from interaction. From interaction. Well, let's put it this way. He was fairly right. I mean, energy comes from breaking of bonds. So fire, in a sense, the burning of wood, is breaking down chemical bonds of wood, the storage of energy. Who thought that he would be actually right, that nuclear physics in essentially is the breaking down of something to make something smaller and the creation of energy on such a small scale. So why such revolutionary thinking all of a sudden at that time without any technology whatsoever? Well, let's put it this way. Back then they were curious as to what life was, the meaning of life, the definition of life. They were, let's say, curious about God. So now, the next group I want to talk about is a pupil of Callus, sorry about the name, Anaximander. This guy, if you can guess by the English, came up with the Big Bang Theory. Yes? Well, close enough. He actually theorized that life started from primordial chaos. So it's an essential point. And in this, we have defined opposites, such as when cold, hot and dry. Hot, cold, wet, dry, sorry. And he said that these opposites had separated. Now, we know in our world, you know that we have hot, cold, wet and dry. They're not truly separated. But he postulated that such opposites have been separated in the universe and are slowly going apart. By this theory, he also theorized that there are similar solar systems to the ones we have. He theorized that there is an opposite to our Earth, an anti-Earth, to be exact. We'll be curious and find to note that the first time this was proven was in 1929. The first Doppler shift was recorded in 1929, and the actual theory of Big Bang came to be 30 years later. And he was actually nearly on the dot with this. But of course, we as scientists don't just work on theories, we need scientific proof. Well, what about this guy? Another Greek, unfortunately. His name I will not pronounce, which is 276 BC to 195 BC. This guy managed to measure the circumference of of the earth without leaving Egypt. Now, it would be amazing to note that they actually knew the earth was round, and it took us God knows how many years until Galileo came along to say, listen, the earth is round. And the church actually lied about it in the Kyrgyz world. There's this group, the Ratos for short, used to live in Swinert, which is now modern day Aswan in Egypt, located conveniently on the top of Cancer. So what he did was make a few basic assumptions. He assumed that Alexandria was directly north of Aswan, and that the distance between the two was 1/58 the circumference of the earth. Now, this last one was actually scientifically proven by him, that due to Aswan, mid-noon, there was no shadow, so the sun was perpendicular to the zenith. And that Alexandria was a shift of 7 degrees and 12 minutes, which accounts to 1/58 the circumference of the earth. And he assumed then that that angle reciprocates the distance. And no, I'm not talking about Christmas, there was an actual camera involved. He actually rode by camel all the way from Alexandria to Aswan and came up with 5,000 stadia, or 800 kilometers. Now, he rounded it up to 700 stadia per degree, which gave him 252,000 stadia. So that then you'd be wondering how close did he actually come. So let us convert to the index using that conversion. And we get 39,375 kilometers, which is very close, saying that the actual circumference is 40,075 kilometers. And error is than 2%, without a telescope, a map, or a compass. He actually managed to get the circumference of the earth with a camera. I assume no one will go and do an experiment with a camera nowadays. Well, let's continue. I assume everyone knows Isaac Newton and his laws. Well, unfortunately for him, this bloke, a Persian scientist, beat him to the punch. And discussed somewhat three most important criteria: perpetual motion, inertia, and the concept of momentum. Now, the term for Ibn al-Haytham, Galileo would not have come up with a coefficient of friction. So essentially, this guy was, in inverted commas, plagiarized by Isaac Newton all those years ago. Now, to be fair, I'll be fair, Isaac Newton has to be given some credit because he mathematically proved everything. So, being fair, we'll give him that, but he didn't come up with these things. And, to be sorry, Ibn al-Haytham did not come up with these things either. Because there was Aristotle before him who came up with these things. And yet again, Aristotle is not the person who came up with gravity or equilibrium or such concepts. Unfortunately, people back then knew about these concepts and used them daily. What they all did was just write it down and explain it so that one could understand. And what Isaac Newton did was mathematically prove it. Now, maths. I haven't talked about maths. Unfortunately, maths is one of the oldest sciences on Earth. And this guy here, who's the known outsider, an Indian scientist, went about trying to figure out pi. Now, I will make a clear note. This guy used to live during the Persian Empire, in the time of the Persian Empire, before Alexander the Great went about and ruined everything. This is his definition, which was translated later on by Clark in 1930. He said, add 4 to 100 multiplied by 8, then add 6,200. You should get 20,000, at that time you got 20,000. If one could backtrack, you get 3.1416. Correct 5 significant figures, which today would sound like an incredible feat, since nowadays we can do over 20 significant figures. And without a calculator, when you're doing this. So, that's a brief conclusion. Is there more? Of course, I I just scratched the surface of history. But the real question is, are we taking things for granted? We work so much with technology, with burettes, calculators, compasses, maps. How much of these things, without these things, would we have managed our science we know today? I will conclude with the same quote I have, and make it up to you to decide whether or not we should respect history and appreciate what was given to us through all this hard work. Thank you.
The Electromagnetics Research Group, which is held hosted in the University of Malta. My name is Bonello. I have completed my BSc honors and I'm now currently reading for a master's in physics. This is the whole group, the whole EMRG group, which is led by Professor Salmon, who is standing up in the middle. Well, I am studying MRI at the moment. Why do we use MRI? A question asked by many people. Well, basically, it shows differences between healthy and unhealthy tissue. As you can see, it can be used in a number of places, as I pointed out over there, such as the brain, joints, the heart, the spine, kidneys, and it is also used regularly to locate cancer. Over here, we can see the image of an MRI showing the heart pumping, and it is through the MRI that we can see the healthy heart or an unhealthy heart. What is an MRI made up of? A question asked by many people. Well, it is a non-ionizing medium, basically, which means it does not ionize the atoms which are inside it, and it is used, it functions on the use of a very powerful magnet. 30,000 times the size of the Earth's magnetic field. We have three types of fields available at the moment, three types of MRIs available at the moment, which are 1.5, 3, and 7 Tesla. The 7 Tesla are still in the experimental stage and are not used on patients. Now, also we get 3D images from MRIs. As we can see over here, we have an MRI where you have the gradient points which are set up over here. The range of frequency, although it is not clear, are slightly towards the center. And we've got the whole magnet which is over there. Obviously, we need these three magnets to give out the 3D image of the patient that we are examining. Now, is MRI safe? Well, till now, today, we have 10 million MRIs being done. In America, we have an average of 50 accidents per day, which is quite high, but obviously they're still used because they are needed and they show things in a higher resolution than other medical technologies do at the moment. One thing that would obviously, I think, you'd all answer is that if you suffer from claustrophobia, as soon as you enter into an MRI, you will find this rather uncomfortable. Why? Because you're set into a very small tube, as I can show through that image over there. However, MRIs are made up of some magnetic field, as I said. Now, yes, it will attract metal, but what else can an MRI do? Since it has a magnetic field, as you can see over here, through the video it will be attracting the metal. As you can see, it has a scissors attached to a string, and it is being attracted towards the center of the board. The field, as you can see, goes far away, even till the end of the bed. Now, a strong magnetic field can also have other effects, such as inducing currents in the body, which as a result of this, we get no long-term effects yet to be proven. However, we get dizziness, nausea, and magnetophosphine. These three reported effects are worrying for one reason, because, okay, Malta have no interventional MRIs being done, but beyond the shores, such as England, America, and many other countries, there are interventional MRIs being done, where the occupation or the doctor operates or works on the patient. If he gets magnetophosphine, which is basically bright lights, bright shining silver lights, he can obviously end up harming the patient. Dizziness, the same thing, and the same with nausea. As we can see over here, I will show you a video which demonstrates the law of electromagnetic induction. We have a coil and a magnet, and as we put the magnet in the coil, you can see there's a slight deflection of the pointer over there, which basically explains the principle which we have in an MRI. Because as we walk through the field of an MRI, we are acting the same as a current can. In front of us, as we cut the field, we induce a current in ourselves. Now, the European Union saw these problems and as part of the 4 directives introduced, one of them spoke about the occupational exposure. This directive is 2004-40 EC. Yes, it was meant to come out in 2004, but the medical industry obviously strongly opposed because it limited the use of MRI in everyday use. Today, till date, we have a directive which is nearly approved and should be published towards the end or mid-2013. This directive states the maximum limit the occupational therapist can be exposed to. In Malta and in Poland, till now the readings we have do not show that these limits are being exceeded. So, in Malta, as such, we have no problems. But as I said, since we have 7 Tesla machines being introduced, yes, obviously these machines will not be in use anymore, and they will limit our works. Obviously, the medical industry wants to move towards 7 Tesla because it gives quicker images and a higher resolution. The Directive 2004-40 EC uses a precautionary principle. And so the limits that are set are much lower before one will start observing effects on the human body, such as those that I mentioned before, nausea, dizziness, and magnetophosphine. The directive does not go into long-term effects for the simple reason that for one to produce such a study, it will be very impractical because of the time duration, and one needs to find someone who will obviously be willing to record his questioning data for such a long term. My MSc study is using this apparatus over here, which is a magnetic field sensor, to go into the Maltese hospitals, measure the field, and the field, the rate of change of flux the occupational therapist is exposed to, and analyze such readings compared to the directives and the standards which are set by the European Union and the ICNIRP guidelines, which are a society which have been doing such work for a longer time, and see if we are working, if we fall under the guidelines. Also, we can maybe improve the current procedures being done in Malta. Also, once that is done, I will be creating simulations using CST, which is a simulation software package, to see, and this is rather innovative in this area, as none of these works have been done yet. And I will be simulating the field and the cutting of flux and obtaining the induced current in the body. From the outcome, I will see if our current practices are correct, what can be improved. For example, if I am an occupational therapist and I run inside the magnetic field, I will be inducing a greater current, as stated by the law. So maybe we can guide the occupational therapist to walk as he enters the magnetic field. And then I will, obviously, if we are above the exposure limits, we will have to take a stand back and examine our practices. However, if we are below, as the indications show us till now, we can continue with such